Nnawotwe Yi so afi na wode wafide na to ha nyame nhyirawo na yeda asenso se watwusi ese yenka ho ewo memene dana piety say na watwe akwa aba beto ye so yesinkonya na adwundwe o man Ghana ho na watwe we enzembebre na SCC wo mu yenim se issues with the voters transfer abe ho ya eno wo ho asanso yenuanom a mo ye renal patient semi beto dwa from the NHIS and abayashe senka for the next few months I day to the end of 2024 no NHIS na dialysis cost for renal patient no on February and no mo nsembebre na bebetu dwa ade na nka wo say sha 1st June no na wochi we mu nyina na patient no still are no mu tua for more dialysis sessions adenti na economy ye bi say into NHIS and kra no kwan be no betumi afa so sustaining as a cost offer with dialysis no yebedi ho enkomo ewo ha na biom onim se asemba kwa ewo quarter akwaba dia dandane the ambulance trial edru be between 2014-2016 you say that time NDC aban ekra ambulances be Dubai never cancer organa ha no na broni be can not fit for purpose and no na by way the Kodam court in 2021 say there also a charge or a doctor case to forcing for causing financial loss to the state or no any doctor amenama nanko the chief director of the health ministry no so no can be the second accused and a third accused the businessman Richard Jakpa ne bedru bebe no enam ora amenama na pom din 70 state no file no le press for no tebeka doctor to force any Richard Jakpa omon sensem na work lawyers for to force cross examine Richard Jakpa or the two just say the attorney general and anything come at odd hours enya dia senefata or so or no ebo attorney general to make a case against to force and munti lawyers for to force any lawyers for to Richard Jakpa nankasa the applications called court say be ya enke asem kra no ye say ni baby ekodu ni baby friend of trial senior asem ni dane no o say court no kra bo asem no etugu na no na watwe we court ni sin konya the ruling betu just say trial no mo kan de ojetumu a enye again state of prosecution no mo hwehwe no ojetumu a enye case an application no mo de buy say unruly say omo enye hwehwemu into the conduct of the agent so or say ono so only the right authority so bet me make a procurement no pronouncement nti ono so onti obo applications na edugu ye na no ene ye bisa say intimestra na kra no ekyeresen eno so ye nsama ye bedi ho nkomo ewo studio ha na ene omo amekansa me ne omba be hye adwumadi ase Orabafo Ahinkra, on a president for Renal Patient Association of Ghana on our studio. Orabafo, we have a call here. Okay. In studio again, Dr. Ezekiel Ohene Ejekum, a member of the MPP's National Communications team. Ezekiel, we have a call, Doc. Great. Omo me join here me to me di Jumawe Dr. Abuajeda Costa, CEO for the National Health Insurance Authority. Onoba be join here via Zoom na no edi in komo. And again, Rakwami Sapwan Siedu CDD fellow and also a pharmacist oba join here via Zoom na no edi in komo. Frank Toblu, General Secretary of Private Health Facilities Association of Ghana, and also join here via Zoom na no edi in komo. Richard Manoribe, a member NDC's National Communications team. You need a quite Sir Baba Cancer. Na no Edding Como. Na Yabasha, I mean for NHIS for statement, NHIS statement, I'll told you. I'll say NHIS free dialysis coverage June 1st and June 1, 2024. I'll say Government of Ghana through the National Health Insurance Authority in its 20th anniversary celebration is pleased to announce a significant enhancement to its health benefit coverage to include dialysis patients for a period of 6 months as follows. A, vulnerable groups, that's patients below aged 18 and above 60. Into omo 18 na se for ene omo nya 60 ene ne mbroye no omo no category 1 or say patient under 18 above 60 years will receive all 8 free dialysis sessions per month under the National Health Insurance Scheme from June to December 2024 as indicated on table 1. Inti those 18 and below, no, any above 50 years, no more there free 8 dialysis or 1 year in a month in an year. There NHIS afahoka, and we're breaking it down. Come, I'll say June 2024. Total number of verified patients to be paid per month here 84. Or more total cost in a year Ghana cedis near 329,952. Cumulative cost 329,952. Sa 84 more 8 sessions per month in an okabomwa near Tinono. Osha Noah or say the cost of dialysis for these categories upon verification of the actual patient on the dialysis is projected to be 329,952 per month, and by the end of December 2024 the cumulative cost is estimated to be approximately 2.3 million. By the end of December 2024 now you are spending 2.3 million cedis on ASR patients, no. Na category B, no, so also persons aged 18 to 59. Patient from Nnawotwe Teaching Hospital, CAF, Cape Coast Teaching Hospital, CCTH, Efia Nkwanta Regional Hospital, Ho Teaching Hospital, and Tamale Teaching Hospital, except Kolebu, will receive 2 dialysis sessions per month at 982 cedis. That is 491 cedis per session as indicated on table 2. And also now we're breaking it down. Come, into no Osha or more costs. And for example, June, say, you know, until okay, so the total number of persons there 147 within that bracket. And also we're breaking it down. Come. I'll say by end of this year, December, now I spending 1.01 million cedis on these people. Kolebu patient benefit subsidy, more than different. I say patient at Kolebu Teaching Hospital will receive a subsidy for 2 dialysis sessions per month at 491 cedis, which is 50% of the cost of session. That is 245 per 0.50 pesos times 2. There's a more than more per session, no? Over 245 cedis 50 pesos. Due to a philanthropic gesture of 380 cedis being offered to such patient as indicated on table 3 or address the equity across all facilities. And there's a Kolebudi already more subsidy than that. And then NHIS so the way Ebabeka home. Overboy made me at Yasi. Yes, so running crowd. Where nature say?
Yo, me that's it. I'm say a committee net na we Nusonami and Casameka home.
Okay.
I'm a president in Tinu. I'm saying, you might be brave. One na scanusa. Na buying so my ETS say, why in the budget a week for the year? Until for now, not the bit me provided. No. Until category B na a BEM. That money was being provided by National Health Insurance themselves.
Okay, category B, which is persons aged
19 between 59. No?
Okay. Now NHIS to other data.
No.
Okay.
Which I say scan that one I debate me like 2 million from government.
Okay.
But yeah, not so she.
Okay.
It's a tenance no. Omode actual and buy na ye hwe when I say cause 0.
Okay.
Until we say children between 0 to 18 and those above 60 no numbers in ho. So that money could have sustained those people. And almost no more vulnerable, especially in Kuala Lumpur. Omanya regular dialysis amu free muntentem. Omanya regular dialysis amu free muntentem.
I remember a story I hear of Cape Coast, a young girl and Bible boys are buying from war.
Good.
Channel film.
Sister na Satan sa ade we wo wanka Kuala Lumpur. Because na ko binya no regular dialysis 2 sessions. It's supposed to be 3, but unya 2 now show here. It's okay for you. Intinu you share in that say we have to push it there. So we push National Health Insurance say this is not be use category B in year free until further notice.
Okay.
Until we push National Health Insurance came out with 2.4.
Yeah.
2.4.
National Health Insurance.
Yeah.
2.4
no by the car. But so those who fall within that you know.
Okay.
I'm the sorry.
I mean 1.01 million.
Good. I'm the sorry. Now we just say they intina Kolebu issue. Yes, I'm in Kolebu. Kolebu, I mean, no crane. For the past, I went to Kolebu 2015.
Okay.
I've been on dialysis for 10 years.
Okay.
Yes.
Wow.
I went to Kolebu 2015. And no more honor. You say I don't know. You into yes, I say you association started say you copy and unfortunately for us, one guy be I'm on the first guy group of company owner no, only your old student. Okay. Into no call no per transplant no come papa no. I didn't come papa na come. Then the man came in. Ube who you apply to no so good to your mind. It's not can be or to it to can that no or status so to ya. The man has been sponsoring us from 2015 up to last year, May 21st. When the consumables got short at your 2 units them down. Okay. Last year, time I started dialysis. When we go for our sessions, the man was paying for us. Okay. In 2 months, you resume back as of October last year, no. And I could because of COVID, no, the man's payment was not regular. Okay. Until we should start paying until further notice. Okay. So from last year October up to now, we are paying. Okay. Until you call negotiation table on this issue, and the BP say there is a philanthropist man who is paying for us. Okay. As to how detailed it is, I don't have full grasp of it. Until you tell us it's a Kolebu sa offer we there, and you meet us halfway because we learned the man was paying 380. Yeah. So if he's paying 380, I don't bet top it up. Man do 491 because you see dialysis costing 491. Okay. And to bet top it up, man do 491. Until I mean the chairman for the committee was Dr. Nsiasari. We look at all those things and realize that this is the best way we can go for now. Okay. Until we pushing and that is how it came. Kolebu is receiving that subsidy. Okay. Because of that man paying the 380. That is why we are doing the 2 something. I've forgotten that thing. I have it on my phone.
Okay, so 245.
Yes.
Ghana cedis 50 pesos.
Yes.
Per session.
Per session.
Twice, and 491.
91.
But already, yes, it's 318.
That's what I'm saying. Sir. From last year October.
Mutua full.
Mutua full.
Into 318 and away.
Kolebu can answer. I can't answer that.
Answer that war board. So you can't say.
What I'm saying is that maybe a committee now. Now we're supposed to look into this actual. No. Yeah, we invited them. They came. My explanations being there. They say, Papa no they can be into that money that comes, goes into Kenya. They know. Other hand, other information that we get, which is not. I cannot see how authentic it is. That is not so. That's why I don't have full grasp of those things. But all what I know that there is a man, or there is a, let me use the word they use, there's a philanthropist paying the 380 for us. And Kolebu is, National Health Insurance is coming to do the top up for us. Okay.
Nti mamenti ase. Nti woko ene sebi ya Kolebu share de we ase. Now National Health Insurance you 245 cedis amount. Subsidy. Or no better as can be an
because there's a philanthropist paying the 380 for me.
Almost starting.
Starting, no, we had a few challenges. Challenges nearby, and I said, I think the day, I don't know about Monday, announcement in about, even though the first was on Saturday. Yes. Yes, so, back out, clear. It's Monday, a back out. Well, communication, a back out proper. That time, like Kolebu, for instance, first session, the same me say, me call 3 a.m. And I normally, and sana be concerned, you do receipt and sana. You go on the machine. Into normal, we pay Sunday evening before we go. Into the bar, most of us we paid already. Okay. Into I remember calling Dr. Da Costa. Say, Charlie, no, so we shouldn't worry. Obi away to Abia should keep his receipt. The money will be refunded back to them. Okay. Into like Cape Coast, for instance, yesterday it happens, but their monies were refunded to them. Okay. Until we are also open to Kolebu by Monday. And now, small challenge the BEM was that Kolebu, for instance, were saying, say, Omati, but Omunya letter be there, they were not going to do the thing. They were not going to allow us to do when we come, we'll pay. And I also contact Dr. Da Costa again, say, almost say, Mumfa letters and koi. And no, so letters no call that.
Because the letter is dated May, right?
May 30. Yes, no, I started the copy. I started the copy because Dr. Da Costa, I fine, or no, mean spend, we I tell him what it is, and then we go. Not so. But for we've sent the letters already. So he gave me a copy. He gave me a copy of Cape Coast. He gave me a copy of all the hospitals I cited, and it was dated 30th May. For instance, I was at Kolebu. You're quite enormous. Okay, I'm going to information. Like I'm saying, Obia Nisika or Otiabiano from Monday, they will refund the money back to you.
Okay. Oko Kolebu, what you are saying?
And 491.
491.
Yes.
Njomo refunded, on refunded 491.
Yes, that's supposed to.
Okay. What about the other areas? What can say Cape Coast? Yes, say refunded. The other areas or patients or members no kata.
Confanochi, they like I'm saying, not in our board committee so. The Confanochi they started cry. Once the thing rule out they started. And Monday in Confanochi started.
And no information here and said they no more charge your mom, so starting Monday, right?
No, like I said they started, but now they were also waiting for the letter. I think Monday, Tuesday, they started, but later on they also went back taking the money. But they're also going to get their money from there to be refunded to them.
Interesting. Yeah. Until when your mom, Ebuapa.
Oh, Nyamini no Ukraine. I've been on dialysis for 10 years, and philanthropist in Obama. Material cost zero, my account is zero. Dialysis is very expensive, and we've never seen anything like that. Even though we fought for your Kosra buying, it's a step in the right direction. Me, I'll get 2 out of the 8. Me, I come back for 6. No, I'm gonna be 2. But yet, I mean, they made it clear to us. The budget has been read already. They don't have any money anywhere bringing it on board.
Okay.
Into Yensum. Yes, so about your session now will be so makakra. So we really appreciate what they've done. It's a step in the right direction. Okay. Like Oliver Tosi said, we want more. And now, Dr. Dacosta may assess when they are going for the mid-year review now, they will go with another post so that we in that middle category, they can come back to us if they can get some money and come and support us. Maybe they can get us 4 out of the 8. Then we'll do it from there.
All right. Young Kwame swear na yene ora Kwame Sapon asiede o CDD fellow young Kozum no so na yene no ending komo. Chief, good morning. We have a call. Mr. Sapon asiede, good morning. Okay. Enti yene ora Kwame Sapon asiede bedin komo. But your Frank Toblu as General Secretary for Private Health Facilities Association of Ghana, and so I was Zoom so you know so be din common yahwe quiet pass between am na ye. Doc, you are a medical doctor yourself. You sure say your mom family na woni. Quite many between afa so ebema we no atna se abo because like they say it's quite expensive.
Happen in mecha na machia me wafa. E din ahim kra de me wafa my menu opinion. I was tempted to ask can me offer few kwawana. But he said a title ahim kra. Na ya di mchake se so ma Ghana for so ma jemre ehwe ne ye flag bearer Dr. Mahamadou Baumia na probo a obo na ya da Ghana for say omunya opepa epu ebehwe ye flag bearer ebiti na no munsem ene nia owo ema omani moving forward na Ghana for so nya opportunity interactive with him to ask him questions now on providing solutions na adwento atoa na yedi boomai nti yesre Ghana for say anywhere ebenya opportunity ashia Dr. Baumia ya monye no offer so na yenti na no munsem na yemisa no questions na mo gidie say he will provide the right solutions together I be moving forward. Nti we discussed this issue with some level of empathy because I've been a first-hand witness to Yenua unfortunately, Omanya end-stage renal diseases. But the Kasa, we just speak of the terminal one. No? There are stages from stage 1 up to 5. So when you get to 5, then you say end or him. You are the end stage of the disease.
Stage 1?
There is your kidneys, no. I say fish. The kidneys don't survive without water. And see, until now I say you should always hydrate to about 3 liters of fluid in a day.
And
say who lose insuo, for example, diarrhea, vomiting at a pace body non teaming compensate, it can tip your kidney into failing. But one thing I hear dicey about kidney is that it has millions of cells, but you don't need all the cells together for the kidney to function. At every point in time, we have maximum a quarter of the cells. And the cells near 1 billion. We have about 25% of the 1 billion. If it's 1 million, we have about 250,000 of the cells for the kidney to function. And say now when you be away regular or hospital, or kidney function, you wouldn't notice. Because somewhere 1 million, we have 250 to function. The 250 are functioning. And every month, you are still working until it gets to the last quarter. And ABR say only regular hospital, you can actually see the full effect. Okay. Until we continue to advocate. Let's say, let's go to the hospital. Now, government facilities, at least your consultation is covered by NHIS. Your consultation, is covered by NHIS to go and see a doctor. When a doctor in Kasa, at least we know at lab it will go a long way to help you. That's what I always advocate. Secondly, our courses, but there's some risk factors. The major risk factor the kidney disease hypertension, diabetes. Hypertension has effect on the kidney. When you have kidney disease, you can get hypertension. Same way if you get hypertension, you can get kidney disease and diabetes. And so it will huge effect. Both of them contribute up to about 60%. And see, continue to advocate. Say, hypertension or diabetes, the best way out is to make sure say onasi and our hospital for doctors to do a holistic check on you and give you medication. The various myths and our sentiment outside, see Dr. Ma will draw, say, it is not true. Doctor any precope ma will draw. Even if you have hypertension, to give you certain medications, we need to know the state of your kidney before we can give you certain medications. We need to know the state of your liver before we can give you certain medications. And see, we don't just give medications. And as a black man or a black man like ourselves, amongst the medications that are used for treatment of hypertension, there are some that help the black man more than, for example, it will help the white man. You see differences, even though the same BP medications. But we people say you approach me far way, who say you far way or then that medication your race also contributes. So all I'm saying is that approach your doctor, speak to your doctor, the needed investigations will be done, and the right medication will be given to you. If hypertension, diabetes are controlled very properly, the incidence of the kidney diseases will be very much regulated. That's what I always say. And Papa, a bit more bear witness to the difficulties he goes through, sometimes even on the machine. Okay. And it's easy. You can react, you can have a whole lot of complications, even on the machine. So I always say that it's good we are pushing government to be able to bear the cost for us. Okay. But pona government it's not easy. Until this thing came in, and yet skakakra no fanya ebia until her or advocate for the colleagues to get way. In Ghana for my hospital. You are the reason why doctors and nurses are being trained. You are the reason why government pays doctors to work. Okay. And see, you're best on the way. Coming back to the issue.
But menyan say yenya Dr. Adom Costa on Zoom. Nti yene ndin komo kakra na mbra. Doc Martin yet say what me ajo any Dr. Adom Costa. I mean yen share senior you know nkofo aka say dem waye de maya de nanso hospitals bebre na Nnawotwe you know etwemu they were still charging up themselves still amojiska and she share say na esi koya ama we na abasa.
Hear what you said. Hello
doc.
Voice no amba papa.
Okay, and tell me bisa say she share na mo de buy nkofo abom abaso say maya de na mom Nnawotwe we still ana hospitals bebre na koso charge for dialysis. na me bisa say nhihye no ko ba ne say na afi de ba ne say my ready some betua na nso na nkofo sela also mutua dialysis.
Okay, me da say any question about booster me ma me fan sia ema Ghana phone na yen kan share Ghana phone na ne say NHIS another NHIS they also have a boa ama accommodate afa ne ntuma pa efra na ni nyina ne say aban MIS sika say yen hwe ekwan e be fa so a ye de e be support dialysis for you na yenya asaka no ye ne say yes a committee to see that the area e betimi and you to start first na ne say forming committee no ne ma your friend dialysis for nanka patients no omo leaders no ene ye busa on say kase na yenyo na kwan ba ne be fa so e betimi dia support mo and omo ka say ne here there most of the patients now what dialysis no I want on be provided that centers na my no more I provided on my list either am I and yet ye ni enim ne say your forming committee no ya the doctor Chancellor na to ano and I did all the CEOs of the teaching hospitals and so by the teaching hospitals being Kolebu Komfo Noche
Cape Coast
whole teaching hospital and Tamale teaching hospital and also Okba Ghana House of Science or baby power Mukwa Fancha any of the Cape Coast teaching hospital so can home any the forming committee. It's the committee in the reporter about any say the first Ghana yes for the needy and the vulnerable. It is for the needy and the vulnerable. There are any certain color in a decline. Our vulnerable terms of a neoma, it's the first thing we did was to consider in color. And the date you consider in color, who said that in color crowd, almost said that notion, give it me up for cunning in our eye, I'm open. If you really say, okay, any idea, yeah, in penny force almost 60 years no it's the affairs so almost 60 years no almost not just say you bet me I way I can say you bet me after almost yes okay in yes idea the way the 60 now we are for idea in here a canon you better funny in our mouth our sections now be calling in that was the first category of the vulnerable. Ena ye no ene ehun se scanan katakra no asa be abande mae no ni say NHIS yen so e den na yen ankase ye be de ye betimi aye ene say okay the ye betimi aye ne say yes you be kwa social corporate social responsibility budget ni mo ne ya hwe the betimi anya kakakra e di aboa in Pennyfona almost over the ages between 19 and 59 now. It's a call, let's just say, you can subom we are the additional 2.4 billion. In your bit media can't near abide mine, which is 2 billion near the Adiduma. And see, in that 2.4 billion, no. And you say, okay, in here, you're distributing equitably. It's yes, distributing here, say, okay, can a best 2 sessions for the ages between 19 and 59. No? Almost, a best only 2 sessions. The Akoba is on this, Kolebu, almost special case because Kolebu no, Anquan can be a show master dada.
Okay.
It is all per on equity purposes, no. Officer, wow, be idea. Any NHIS a Kolebu, so young, say, for Friday, Emma. It is say, I Yama Kolebu, say, 2 sessions now here, Covano, almost dear, because there will be more than into Obinia, just 50% of that 2 sessions. And that was the decision. Committee members, Obian were rejected. Yes, you told me. If you get to move naka eda ebe de be sha asie na ye nyina ka say okay eda ebe sha asie ne de because ka ne de na finance so nyame adom akufo abne Dr. Bawumia omo ediska no amaye inti na ye ni problem dia inti scan me no ka say scan we account mu eti de ye ya ne say ne ye betrol letter na ye de ama teaching hospitals for no na omo another centers na omo ombeye no na ye ya making it public na omo catch there say teaching hospital for no catch there say omo internal mechanisms that the info the case ye sha there any problem but omo no just say omo put omo house in order answer
okay
yes okay any share the omo person put omo house in order kra na ye sha there 1st of June na ye nya sha there patient view obebe bia the claims form ebe can letter ne ho ye at the end of the month, you have reconciliation. The patients ne cry etia cry na ye do almost kabe mo. If you hear less than the common hospital ni mo na, you be key that clear say they may have implementation challenges initially, but patients you be tria bia no because you will less that any your numbers that utria ye do kabe den ebe ma. If you so almost say almost say as no almost say sa na tie dia any me announcement no.
Okay.
Now, I'm starting as soon as possible. I'm going to just meet you on board, normal MT, management, answer no. And see, we made the announcement at not a Saturday, 1st of June. Any letters no about out to the public. But because they have to say, regardless, almost you have so you're very fundamental problem being because at the end of the day, these are the patients and they be a hospital no. Almost records already no that. It's just a transition phase in a ISA in Crawford. Now I'm saying na see we media no media ni study here.
Okay.
We should na me media ni cho say yes so mu ya munya abutre kakra. Fi start program dia. Enya fi start na abrochiro ba bia o start program dia. You give yourself about a month. Answer no what say I interrogate no. Na CCAS that year now rush dialysis unit. Now connect or mutia. That's the name says so an impening what say you very fund you almost come on. Then you misreport.
Well,
but also I can say
Matthias here, Nemo yes no share statement I'm to just say effective 1st June. And it's a mutia there. That's why I want my explanation to me Matthias here no.
Met me at letters near the teaching hospitals no. Some of the media houses cry met me the amount. Omo ya throw omo say it started 1st June but say omo cost to akra na ye be reconciliation near the omo sky den amo hospital na gia tum omo refund the omo sky amo ye the claims form den a say
okay
na we the good thing is that can wo ho nya fe ne yakwa peska e dia be yet say we can wo ho Ministry of Finance near buying e this can den ama
okay
it's initially there many teaching hospitals need a meeting and they almost can't say they are ready to implement it. I'm sure that Monday can be there.
Okay. You don't but so mama na member to men call Zoom so na memfa ora kwame sapon do so embrem ora sapon do me that so join here. Oh no, you have an experience from other worlds as well. Kwan ben ye fa so ebetumi ama we na ye nei edimu netumi aboa renal patient no.
Okay, me that's it. I'm a yeah.
Dr. Abuaji da Costa. Rosa Bonse me ho se bia obetumi a reposition ho kakra im se bia wono
aba me ana
Dr. Sapoasiedu oni ye ozum so na mom na yi ne line no e twetwa si kakra.
I think the one friend was line.
Okay, let's
have problems. I don't know, say a network.
I'm sure. We will try and raise Dr. Ora Kwame Sapoasiedu Bium near to me. One so join me. I shall quite fast way to me. I know. But my member on champion, Dr. Da Costa. So It means that we know ye the challenge of the forms na ba no na the payments na delay because we need scan or order dada.
Baby, where the scan or order that for Busumi near the end. I make it scan and I all the calculation. The good thing is say you need microphone or dialysis no, you need patients no. And you no any problem there.
Okay.
But what I say, you need patients there. I know they never way. The money here easy say you need patients no dada. And see, I'm fill a claims form now. You just reconcile near the amount. But what I'll do is say to say the American, who makes me find it out from the CEOs, not to say, who say some of the media houses also call around asking the doctors anyway. Doctors won't take a decision. And you are who say, and again, the attorney say because the CEOs no na take his decision no with them ninety. Ubusa CEOs now, they will give you accurate information.
Okay.
But so, renal unit new yeah, on our own, the management and communicate it to on our own. So what I say.
Okay.
Also getting the right people for that information very important.
Okay.
Than getting you know.
You better try to get the right people. Ora Kwame Sapanse has now joined on phone. Say what me join here. Na me bisa say kwan be ne fa so betumi ama nhihye we ne de aba no etumi akoyi aboa patient no and even looking at sustainability.
Kuto ena me kan sana line here baka me say. A crobia ni wa mefu a wo health system. E man be part etia for renal dialysis. It will bankrupt you globally. A crobia ni wa wo most countries are amazing models are what we using based on health insurance. Into social commercial here Canina Medium top leadership program they can replace that. The route is here called health insurance. Groups now initial that government will make that call 4 million. I always said that wasn't going to work because I just was saying.
Okay.
It is to say the Yambra national health insurance I never quite pay about the national health insurance. I used to say this woman put it data for woman below 18, woman over 16 hours. But Usha Ghana, the Arabian, the prevalence rate, prevalence rate of renal dialysis in Ghana and a year. It shows them the uppermost number of patients that you get to across the country. There are about 1,450.
Okay.
That is so. Doctor can say, "Ube to me at prevent to hospital in 10 minutes." And ube to me at it's even no so call into primary renal failure. Ube to me slowly down go into secondary, tertiary, and then eventually end up on dialysis. Into I don't know, but yeah, share how I fund the dialysis. Also, the total number of patients are to be do over 1,450, unless, of course, if you have DC, like, you have a Galamsey, and then the prevalence changes more areas like but the doubt is a now, share 1,450 now share numbers, NHIS, the actual amount now, using 491 per year. If the NHIS, young woman can now abide just Emma woman. Makase, woman to me a cater for that patient. Because the ocean standing a banner and the parliamentary house at Ocean. There's a data woman say, oh, your disease is my NHIS. They abide my NHIS and Kasani. There are some years, just about 6% was wrong. Yes, you have a cap for a while to say, no, Sika is only now 17.5%. Even the cap look around a few, but that's not. But even Sika is a call more on the ground. That's how much of a movie as coming. And then Makasa, the first thing, and that's able to be hold the NHI truly accountable. Say, hey, move it to me, and I'm going to be. I see a woman so called Musika. Now, one board who say, I manage Sika. Not saying woman some actual scientists there. Woman calculating numbers, one like I told, if you are nipper was meaning because look at woman is saying, could you renal dialysis So Utia, Opinion was to the also was for 10 years.
Yeah.
But Southern Collar, a coma Southern Collar data. The brain surviving more than 16 months. In fact, on more top leadership program now,
yeah.
Consultants know about the castle, a Columbia Bina, Wukumano, or Kababy, which is dire. It is a national health insurance scheme, even with this intervention. So, eventually, improving the survival rate of Incolano Crana. Enough reason that make sure I see a cater for women now because you're improving woman survival rate now. So, women to age, man.
Yeah.
Woman within that cohort of 18 to 59. Woman to taxes, less annual man. Woman call filling station, woman to NHIS levy. So, indirectly, no, I didn't cry woman through indirect taxes. I say, oh, where you hear to me, sometimes me too say a coma, because government and social NHIS releases parliamentary and the other one. No government has released 100% to the NHI. But since 2017, the crowd woman is been dropped. The Levita was actually a summer. It's a young Jessica. Now, I'm trying to put 2 women NHI for now, woman train years, but woman train. Now your budget can that is the major problem. A conversation about renal dialysis is important. Before you to be afforded, before you say NHIS for new music to be afforded. But you are trying broadly because a baby has this and you're that you're having the same conversations all about it. If Yama is renal dialysis, I'm going to call. Not young saying, funds, what do you call it? National Health Insurance Authority. Now, I'm supposed to be able to
okay, but see, a crime by the first one, a bit me a share a buying, say, Neo Gini and come from NHI. Once we know, say, a bit me a solve, we know if they get all their funding, then there should be something. To crime a bit me a first one, a bit me a buying a release for NHI, no more to me or some way.
I don't know about advocacy. When Yasamra, I didn't have to come and sometimes from back to front. Yasamra, I'm running said the young person coming because also who could chase a car. Who cost filling station out of petrol book come on our supermarket outside them. That 2.5%, who can Akuma Pemu say, on Tiapa, who do NHI card provide no or service. And then will be. We were trying to catch them saying, now be a team, the Academy, we will never see with me. She can't get the mayor, but browsing with the battle of Ashawayarisa. And none of the fundamental problem. It is also from 2017. You will be time I want to cause one call cap now. You know, you are side where wrong. And I said, I can't be a bankrupted NHIS. True to our work, and as I say, woman is coming. It is always under choir. Can you ever say, Bada ye can? And see you because I am a sat here. Now you're yet catastrophe, self, you totally fat your money. And you see you can because you are now quite a hollow and your party card by year shall not say, with a buyer, yes, okay, you are now one kid, you are now on the face. And no choir could you to be a fast. You think that they be a bit away. This friendly and the NHIS in Sinchen. You are the least of the problem.
Okay.
The major problem you are buying. Our own first become anchor. And like I said, no, to say the parliamentary answer document and Adom, no government has released 100% to the NHIS since its inception. About the year, because it's an non-family. But about way by, sometimes 6% not more. 2022, 0. And then now you are saying, everyone, and you may guess so, that I want to cost to me back now, on new advancements, or can't point like a cap, maybe a circle. And like I've always said, the cap was wrong in 2017 and wrong now. And no, the ASC, your book who they do, could you see a perfect, a bio, and NHI, it will be renal dialysis patients and other patients, because you cannot, and now by India.
Okay.
Yeah, you can yet to a yaji. Obia di who quite for Becca train say that you can only see or no better the other day. Not just if I call one from Buama, and I will be a cassia because then you go to they need the whole year. And the child will be a tour. Can you imagine if I buy a that's all castle would chat? I don't say come out castle would chat. I don't back with nice and video. You do got nice and video. I'm not castle. Chat to say, she can't be who's a bit I buy no on say yes, me no person there. I buy no so at the end of it. Sad normally be less here. It's a bit conscious Adam.
Very interesting thought there. I mean, we all know, say, Senior Wakano, or see ye cap nefiho, or see a advocacy. Members of Parliament also to me move. One partner also to me ensure, say, you know, sa cap is off. And your MPs. Why not bet me a bomb mutuja amasade na tumi akwana?
Kojo. Say ye kasa nyoma we na ye defense. Mameka sem back mati. Politician bien niwa, and I said way 2 days ago because of British Council. Politician bien niwa, obey taking a decision unless we put the citizens no. Ever reacting.
Okay.
Politicians work with leadership globally. Ghana included. What would test waters? About the source. Say, and dear me, who bet to work here. So, who's over to work here? Or bet your side. Yet, by way, yarn, what the coin is a not the coin show. That the Act of Parliament at all. The NHIS Act to, and then come out the LI. I could come to what happened. And you move citizens and you go by you now, or be uncle Supreme Court. Hey, the Abai, if you cry now, it's younger. It is a citizens be a now, but yeah, your problem be here. Let's try by my on yet or pair. Imagine your home for parliamentarians because parliamentarians also. Yet you have to tell me, what was one from one year? I did where I am right here because now I am too.
Okay.
That is the role of civil society. That is the role of the journalist. And no, they are tell you a fund oh, wait, it's not the party that want to more this time, and buy all yeah, damn, why you know. Now you buy support. You really are so NHIS card no require now my colleagues in the pharmaceutical sector as I said the American carry. That private hospital play castle, so one chair, come chair castle November. What a load of chaos. I don't know it is advocacy, no. Every citizen's agitation, and no business.
Okay.
It's bureaucracy. Parliament be our boy.
Okay. Say you know, say this shame na you know idea holding boy, especially in the run up to the election. Or see this issue major. The NHIS it has to be decapped so that want to me anyeska. Dr. Dacosta, remember where ye at the end feel beboamo. As we speak, plans to saying to sustain this provision beyond December 2024.
Medasi. I think Sir Kwame Akase Yepa Okasase expect obetimi aboye na yenyina of course Ghana yenyina ya fa enioma dentuma pa fra e ya pomuden ho. Now the from baby am tie ne de minim say aban e wo nhyehyeye enkosi December 2016 no na or the san nhyehyeye no atodwa so nim say wo apena parties grab a launch your campaign anyway but the minim and say aban there or consider not renal diseases but consider chronic diseases.
Okay.
Because so 1 years so okay, yeah, dialysis we are and I kidney diseases we are. What about the other chronic diseases?
Yeah.
Into your buying air no holistically. Now I said you bit me aye. Now yeah, you want NHIS we are this your first year. Now you're making sure say and no on a long term no aboying. Yeah, health insurance you buy I focus on yare. Baby, we yare answer no akọ hospital answer na yahwe answer ni ama wodru. But to share advanced countries now, almost health insurance, almost health finance no. A focus on the brony friend no. preventive no. Na oma fund sometimes they also fund what we call the determinants of health. And see, say abai, I say obey preventive no, aka curative no one, and no. Not just abai episode just after NHIS I did 20 years no. Ya shame ya who said there be baby I come ya nhwe ye ni amfa preventive na ma dache enioma entimi nyeden enko ye enti introduce preventive no na yemfa preventive no enka ho na yen reduce yen cost na da bia na ye kana da bia na ye de no ye one way now so yes apa the o ye ne say oh my Ghana for so any a check because at the end of the day so me catch you say every month bia no you say na kokko hwe wa pomodin so we are here you be den you be treaty amount early detection key to bibia eno no e ma en kodru mre a obe den you be boka bebre enti eno asu ye nhyehyɛ ba ko a aban edebeba enche bia by June yi July ye sure say mo bese ho instem
okay
again every who me say yeah more advocacy say nkofo ni fruit nkofo nya exercise into hwe as see enriches that abansa na blaster for no be call kobo march no omo be try me e wo me office we catch almost saying yen hwe kwan e be fa so e be ma physical activities in our sports e be integral part of enyoma ye nyina so de be ya o sorry anofa e bia walking obenante kra if you leverage on sports and physical activities to educate the population so we involved in now when you're a healthy nation you have a productive country. And we show what dialysis is. We are between 19 and 59 now. They are the young, I mean, obviously, most of the youth between 19 and
59
upwards, no? They are affected. And the numbers near scary. And they say, and you see the interventions, hypertension, diabetes, it's how are we addressing that comprehensive we say no? The non-communicable diseases, no.
Okay.
Meaning, this preventive approach, okay.
All right.
Yeah. And see, you want to say, I will also sustain this renal diseases, renal disease, and our renal diseases. But mama, yen share and non-qua, yen share the other chronic diseases.
Okay.
Yeah, no, na me sure say a bind bed and every. But Nina say. Ye betimi no ye se di onyake to obema no ono anu onyake se obema who says adie we akoso we say 1.5 years near people have been making noise and way and to say abani NHIS atake that step we are me sure say Ghana for nyina support it na ye hwese de be ko ye kra no ye NHIS so ye see we say learnings for us and when you be sure ade awom. Okay. Let's say after 6 months, we say ABI full implementation, depending on arterials, never bano. You can say AB krana. You bet me the you can say to say the family kind of kidney disease patients now. On by ABI about 1,400. And no AB kra bit me about the count.
Yeah.
It's just no so your arterials no. Am inside data no? SSA net here. Not by that no. You said the total cost. You said the kind NHIS no kura na bet me aye and answer the anfa kan ho e begu na the kan ho e begu and answer. Okay. Ni na ye nyoma ye gusu aye deliberations no. But in the interim ne when you bet me the abo said the be ya omo a e wo renal disease no omo beto omo kakra.
Okay. Me da se na momti na kire ne say ye nuanom omo wo western north ne ade ne e da so mbeko Kumase ana omo ba takrade na watumi enjoy bi manisu ade hunu say bia going into the future say to me ehu kwan betumi aboa bia ebe nationwide, right? Maybe in the next 30 seconds for me.
So in fact my catchre omo penny no the oda omo no bejo ahenkran say yen koso yen gather data because at the end of the day omo na di data ne brain onya na etna e dem na say data ni nie.
Okay.
Okay. Data ne bre. Yeah, finance na yeah. You can way, but maybe if yes, you reduce your cost over long, a long term.
Okay, doc.
Anything at those interventions, you say.
Okay, doc.
Penny no ever catch there say. Listen,
Doc, medase yenko formula na yembra. Memo akwaba enfambra na watwe adwumadi so Adom TV. Try to honso Sempa 94.7 FM. Well, you didn't come about the NHIS and omunhwehwe omde aba some beboa the renal patients no. What Dr. Abwajeda Costa SEO for the authority and no more hwehwe some say by July Abai Edinson Baba Tuja Beboa towards the care for renal patient as well as other chronic diseases and you need that kind of but Ora Kwame Sapwansedo is still with us. Me call hot na afi mamagina ba member studio doc you were to make a point and I'm trying to correct.
So yeah be can say yeah be aba so for the intervention or the aba because assisting for such management we share the amount of monies the patients need to expend. Now, it was huge, and I'm happy once again. Say, Yako a step in the right direction. Oliver Twist will always ask for more. We would continue to advocate for the unfortunate ones, in quote, amongst us, sebi, omanya yareno. But mojide so, because if you look at NHIS in particular, despite kasa about capping and whatnot, if you look at the figures, then you can see how this government in particular affair with NHIS.
Really? But
exactly.
Mama so since 2017, more sika percentage.
At the end of the day, yema 10%, 2%, even 0%. Let's look at the membership on the scheme and how much time now government AO facilities. In 2008, before exiting, now the active subscribers were 12.5 million for NHIS. By 2017, now reduced it to 11.03 million subscribers. So we can do the cost-benefit analysis, how it was managed before this very administration. Now, as we speak, active subscribers on NHIS are 17.2 million. So even if government is not giving the direct monies through the levies now you're charging now, so membership no was rare. Their contribution can sustain the scheme for a while. We continue to advocate for government to release Sikabia Wasayako. But say not attractive to the people. Numbers no ever form. And that's the situation we saw between 2009 and 2017.
Your argument is that because numbers it's sustainable now. Is that what you're saying? I'm
saying it will help you, cushion you, give you something because there is yearly premium. Most of the people on the scheme each year, there are certain people are omuntia premium. People on LEAP in particular, they don't pay premium. Certain poor people that the assemblies can vouch for. MC and DC, Edenesa, Esocrat, also the such people no call authority no they will be registered for free. But the numbers no those one. Yearly premium no bar. You are going to raise a lot of money yourself. There is premium now you to directly to the authority. And our levies no and the central government. Now central government are releasing and also so the streams of income no A2. The everyday subscription, for instance, I daba with the short code, met tested. Now my renew my card no, I call directly to the authority. And see if the numbers
I know the answer all compared to the levies.
I'm saying that if the numbers on the scheme endorse one, now you are getting the contribution directly. It will cushion you to be able to
have a challenge in releasing scam.
We are all advocating, say irrespective of which government of the day in our power. Government should be making sure say or the sky back up because it needs to go. But I'm saying that where people are not confident in the scheme, that's when the numbers come down. If the numbers not bad for more, then your actuals now will receive it from contribution your yearly premium no and so back from and that will further cripple you.
Okay.
And see if numbers not also as we are seeing today, 17.2 million people on the scheme as against 11.03 million people we came to meet. So that extra 7 million
population groups.
if population was no problem. Then if population was growing, why would you pick it from 12.5 million and bring it down to 11 million when population was growing? You came to meet 12.5 million people on the scheme.
We moved from the mutual to the national health insurance policy.
The total number.
No. So when we are moving from mutual to the, it's an upgrade of the subscribers. So in that, a lot of people would have not been able to upgrade as it stand by then. That's the reality.
When did you move it?
The issue about numbers.
When did you move
now,
it?
Let's look forward. Yes,
in looking forward, because we still need to make sure there is still confidence in people. Say the scheme is working. And how do you determine the scheme is working? If you are buying laptops, now before you're able to make 10 sales in a day. Now at a point you are making 3. Then your thing you are selling is not being patronized. People's love or confidence in your product is dwindled. But if over the period you've moved from 11.03 million to 17.2, it tells you the confidence in the people is back. You understand? And also better, I'm say indeed the scheme is working, the scheme is workable for people to still have the confidence to keep faith with NHIS.
But we still have facilities. I'm complaining of non-payments.
The non-payment,
delayed payments.
There will always be delayed payments, because if I give the service, I need to fill a form, claim sheet. Now I'm submit it to NHIS. NHIS will rather come to my facility to come and audit, send final report before payments are made. So at every point in time, there will be delay, whether MPPs in government, NDCs in government, whichever way or what government, you know. Because I would do now also malaria. Now me malaria no. Now me send the antibiotics to treat infection. Now on the claim sheet, it is malaria. Now we could demand the payments for antibiotics. NHIS have to cancel it.
Okay.
The auditing purposes, I don't think should exceed, let's say 3 months. But if we go beyond it,
sometimes 1 year.
If you go beyond, yeah, exactly like it happened in your case.
No, Master.
I'm turning out to me.
Go rubber for her because I don't know awareness about them. So what Ora da Costa and Ora Sapon. So da Costa said, Dr. Da Costa said, by July, I buy a decision for more as patients no. Then I'm gonna need a coin say mobility from government.
Oh, yes, and Papa may walk. Few knowledge about what Mr. Da Costa was saying. Like I said, I'm part of the committee.
Okay.
So the committee did not, even though we worked on this, we sat down, realized that like the preventive measures, is very, very important. Yes. Because and apart from that, you don't be on dialysis for a very long time like this.
Okay.
Organ bank, those things are there.
Yeah.
So we are looking at all those things in such a way, say, Ghana, accident on the road is very high.
Yeah.
We beat me in an accident, then they kidney, Papa.
Oh, okay.
Yes. Yes.
So we could be harvesting those
things.
Okay.
Yes. Yes. So
say
the politicians, you need a policy
that could direct
and all those things. So
and basically, most of them is that the relative of the patient, the spine body, the family, they don't have the post-mortem system. And then they don't want their body to be post-mortem, and then it can be opened. So it's very difficult. But if there's a policy and then an ally to governing that, I think, and I say it's a very good.
Yeah, it will be.
But even with that, you need the consent of the relatives.
Oh,
yes.
Sure.
That's what I'm saying.
Even with the policy,
the law around it will probably allow that. Yeah.
But you see, he has raised a very good point.
No, he was there.
Yes, about 200 people die in a road carnage every day.
So like I said, we have doctors on the committee. So we raised this thing, and it was Lalaboy. So like, we are looking at all those things, and then we are also trying to get. Say government create board be okay. Nanka fundraising be like a fund be with seed money from government into it. Then we'll go to corporate Ghana. These big companies, Talo Oil, Newmont's Ghana, those mining companies will write to them so that they will contribute some money into the fund, whereby government is not forthcoming. Nanka will fall on those so that like as Yasha say, there should be a sustainable plan. And we are looking at all those things. Committee investment share, access, adninia, to put it in place. Like I said, by the end of June, July, we will finish with these things. Then we'll bring it out. Then maybe we'll send it to Parliament for the LI and all those things to be passed so that we can move on. So there's something in the pipeline that we are working on.
Okay, that'll be excellent then. Young man should be wrong. Nnawotwe. Now, Frank Toglu, General Secretary of the Private Health Facilities Association of Ghana.
Yes,
Mr. Toglu, thanks what we are joining here. I mean, most of these they're quite a fast way to me in extending dialysis services to patients across the country.
Mitia tia ubia watie sisi aye kasei ya hu say the NHIS no or take the right steps ebeboa yen Ghana for ni nyina any hospitals, clinics and the maternity homes ni nyina ewo Ghana enti mebo omabasu say omayade. Now, before Mekosuno, Dr. Asiedu Kasembi said, or say, the NHIS as an institution is sustainable, but question is, Sikadodoa Yeji from taxes and now NHIS levy, Yedima NHIS and no question. Because a sustainability eka insishare NHIS to the extent say ombe to me atuya claims ama omuye juma or to the hospitals, clinics and the maternity homes in the country. So want to mean to your claims up the issue no you cannot sustain NHIS.
Okay.
And on daily basis no claims na NHIS etuano esrua na echo. And I am so happy say Oma has started introducing preventive health care in this country and also ebeboaye to the extent say the claims now omutua sisiano esubeti because so obia nim say me yese meyaria sani panu on cause akwan suda because there is no human being in the world obeka say I want to be sick unim say ufa ha yarebebo na chinchina ubefa sa akwan no so it doesn't make sense. And about 90% or more of human beings they will not go on that tangent. And it's our preventive healthcare now NHIS introduce a idea yenina yasum yebefa kwan bia su to make sure say sa preventive no ayejuma. Now to the ordinary Ghanaians who say your longevity will be good enough for you, your strength, your health system will be good for you. Now mamika some way a drop beer yenum or we drink in this country no any part of the world no ninyina was side effects. And he said if you are not sick to take that drug no it's far better for you say you have to be sick. But of course your emergency situations a you be call hospital. Now come to talk about sustainability once again. Sisi ayeka say National Health Insurance for no omudiyeka bibri omantua, and we are all aware, the whole country is aware. But somebody said within a certain time frame no make sure say 1 month you are able to pay at least 3 months in arrears and continuous 1 month on monthly basis. And
now mo can saying na NHIS demo
Mebaho. Ena minua kasambi oka decapping of the National Health Insurance revenue collected. Idea ayes a Ghana for nyina beye baako na yakatre aban say aban ne awoye no emboaye and it's not helping. And I was at Kasemba could be said there is no government from NDC to MPP automatia 100% of the levy now Odima National Health Insurance ayampa. Mamima statistics be na fire juma. Sikadodo a aban eji in 2013 830 million. And ania omudima National Health Insurance is 492 million. Say about 2014 aban eji 980 million. And our the 731 and wakipo 249 million. Yeah, back 2015 aban the 1.1 billion Ghana cedis and almost the 846 million and keeping 316 million. Yeah, back 2016 aban the 1.2 million billion and Omama 1.1 billion, keeping 177. And about 2017, about the 1.5 billion, and almost the 1.2 billion, ama National Health Insurance, and Oma Kipo 358 million. Say about 2018, about the 1.57 billion, and Oma National Health Insurance 506 million, keeping 68%. And about 2019, about 1.2 billion, Omama National Health Insurance 721 million, keeping 57%. And about 2020, Omaji 2.3 billion, and they released 790 million, keeping 66%. Say about 2021, about the 2 billion, and they gave 127 million, keeping 94%. Now, with these statistics, who said, Sikana Oma Kipono over the period. So, Sikanima National Health Insurance, the condition of NHIS will not be what it is today. Okay.
Now, mono ya democracy. Kasa na NHIS de demo.
Sisi ayeka say we talk on monthly basis. We don't talk about the values involved.
Okay.
You can't values involved. You can't monthly. Now we are talking about under normal circumstances. No, se uko emranuma emrani to say within 30 days. I say National Health Insurance bet you a car on submission of our claims. But ye ni National Health Insurance is different from the law. Say processing the claims, vetting any bibiano before behuno, sa 30 days no, and to me juma. And see Oma Frey and I meeting. I say okay fine. So bet to me within 30 days no, 3 year. And no outside the law. It's not part of the law, but the law now says within 30 days. But yeah, human being. Yenim said processing claims and all those issues relating to the payment and transfers and all that.
So as we speak, I can't say the private health facilities.
We are talking about 7 months in arrears.
7 months.
7 months. From last year. Claims up to November, December had not been paid.
Okay.
Then today, as I speak now, we are in June. Aha.
Okay.
That is the position. Make us say. Okay. But Mami Church Remuse, they also have time within which they have to process the claims and pay. But say you call strictly according to the law, then that is the position.
Okay, yo, Mate. That's Mr. Togro for joining us here. Member studio na yema of about for I mean you move on to the next topic. Over answer ye fee topic we know. Maybe will last words out of my now what me Ajay Hoako.
Okay, the mechanism the doctor can. I think say the youth no yeah.
Okay.
The youth now yeah battle. Master say yeah regular checkup or hospital. And yeah very comfortable situation to be on end stage kidney failure.
Okay.
The ball, everything. When you have a good family to stay behind you, and the best way to do is preventive.
Okay.
Opa, every 3 months be a regular checkup. Not saying a doctor can. When you be bound, so now we're between stage 4 and 5. Now we're called dialysis.
All right. Okay. But because Matty say this topic has become interesting. You stay with us until only ends now. But Papa Ayiko Asempa FM, Adom FM, and Adom TV, yeah, more support. No more day. Near for an amazing Father's Day celebration at Eba Bosumwe June. In front of Asempa FM, Papa Ayiko 2024. I say, Embrace Russo see it to me. Yeah, celebrate amazing father figures. Omode Odo. Care any heartfelt support attaching lives of enkoda enyo mwankasa omuyemba. Yes, send a 1-minute video recording. Fako WhatsApp number 0531003813 0531003813. Now may you those beautiful moments you know anyhow wonderful father figures here to me impact your life and tell you enye wankasa biological father. But kwan bi a wafa so atumi aboa wa abrabom no be ntumi hu sa kwan no fafa sa WhatsApp no so you say obetumi stand a chance of winning amazing prizes for father on Father's Day come Sunday a day name 16th June 2024. Deadline for submission no Wednesday 12th June 2024 by 6 p.m. Inti Michelle Maudi number nyina ye wo eja omo aboy no monye yankasa biological fathers. Baby I do abrabom no obi to me so nsa eboa people to school fees sani pa no be into me hono as a Father's Day Sunday 16 June no beka ya ho 9 a.m. ewo premises ha ewo Adom FM yes amazing Adom presenters no almost ye ejanom no be display omo cooking skills in the fortune margarine cooking nti oba be hwe say bia ayi wala nyone akwasi nsiamo you know omunyina no je CJ mo muina be kansa na yetumi ehu omo betumi aye aduane mana koyie papa omo de fortune margarine na be ye aduane no say ejanom na so be participate in the Jama wash and field washing fund better any dirty clothes into cleaning and tade aye free no on be senior hwene oni madesi pa sounds you be free prostate health screening into prostate be ya okika ka hunse oba e be screen for free na yaji any with the executive prostate center team or multimedia car park or kokolmele ha into modern abra say koso na ti asempa 94.7 FM Adom FM and Adom TV na yemfa heart-warming stories any dedications on this Father's Day and bro ejanom ayiko say Papa Ayiko well menko minia NDC ho na menene encoding komo na ono buy na yet ya share komo na di said that Richard Manarube e bi abokoko de
Aze me hoye
Aze na we tro lo e bia na
o aze me ko wedding be
okay so in terms of our dialysis NHIS we're going to do this but we're looking beyond it sustainability
Aze me share what you for na share for so na meeting share kase no pay free is as John Dramani Mahawa and the running mate of the NDC, Professor Jenna Nopokwajiman. Now, Mr. Bafo, we sympathize with you and your situations as well. President John Mahama is watching. And here, we're also aware in the situation that Mofaso, the party is aware, and we are sympathizing with you. And that is so disheartening. Me, Juma Hospital for some years, and in the situation where you find yourself and how uncomfortable are you. But you see, maybe just say at this situation, may find near politics as well. Dialysis, no, it's a very painful situation. I mean, you and then you say you want to be a found. But it's an opportunity to say, and I want to thank multimedia and Adom FM. So, much of a patience, a diabetes too. One thing about the public, and I say, situation say you can't media and I catch it, but the only platform to inform is through media. I'm not to make us oh that way they send Toronto much. You know, when I was working in the facility before, mostly HIV. So the HIV there, or much control. But when the core facility, me who patients are more hospital. Now amount for NHIS is serious. Now, Mr. Buffo, and it's good to say what I'm a sample of a patient. It doesn't really mean that all is lost. It doesn't mean that if you're on dialysis, all hope is lost. People survive it, and the people also don't survive it. Now, I believe, say, with the policy and programs now, more money, more team, the two in place now, it is good. And now you raise a very, 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 very important situation. I think, say, how we can regularize it. I want to suggest, say, in a case, I'm going to say, yes, there are so many road carnage situations. We share statistics now. 1,000 people died just this year because of road carnage. And it was not their wish, and they were not having any conditions, just because of maybe the recklessness of somebody, and now some route, some mistake somewhere, and I'm losing my life. And they have functional organs and car. A bit me use but I think the government and then agencies near motivation. Let's look at it critically and holistically. But basically, one of the challenges I may say facing, and it's this situation also based on religion. Religion also counts because there are some religions where they will not even allow. They are more nipa say you do open it. Nipa no immediately I say go see it. But you also remember that the same religion so almost so patients that have are on dialysis as well. So you see, so I say consider all these factors are now sharing a bit me. Number two, I think say health preventive is a major problem. I say I do work out every morning, and I always cry out for people who share workout. And people that do workouts out there will tell you, you wake up in the morning, we are workout. As young man, I want to see elderly people running to do health correctional. Because I did not say answer na yeshe. But instead of saying you advocate, even Ghana Health Service, health institutions, say most of the nursing training schools and other facilities, I think they have institutions, you course on health prevention. And so, since I'm confident, they should go back to communities and then advocate. No, basically, in Accra here, I mean, say most of the drug zones. I don't know whether you're aware. There were drug zones. You could say you go to drinking spots, you see all concoctions that have been sold to people. Some disease, some conditions diagnosed by be genetical, but some too is the way you manage your situation, your health. And so then they'll call areas so say this can't drinks or so. Boys, young boys, they don't even want to go in for those. They go for these wee bitters with alcohol and those things, and it all lead us to these conditions. Until we have to look at it critically. But major problem, what is the cause of it? Number one is unemployment. It's one of the factors. The young guys that are most of them are going to such conditions. People are into tramadol, they are into all those things. I did change also when need baby or beko. Just so they end up themselves in a careless and reckless life that they engage themselves. Not all ammonia conditions through that. But see, these are the critical things that are essential. Preventing situation for us to lead into this is a major thing essential. We spend a lot in the health service, but when you do health prevention, it boosts our economy. I think it boosts our economy. We don't invest much. And we don't invest much revenue on health conditions. There are other conditions, I guess, so these are the sensitization I say here. And I think that's what we are doing today, this morning. And we should take the opportunity to educate our people in this situation. And so I believe that let us make sure that we do regular exercise. We take good diet. I believe that it is good I spend much money for a meal than to eat wrong meal for 3 times. What is here? So I do one good meal and it's an unhealthy meal. And you better send me 3 good meal because it's unhealthy to give me conditions. So essentially now most of the young ones say they must say, I think doctors have been doing this. I don't know why I'm doing that. They almost say, they say won't you try to answer what you made it. Say man try to meant to me. the best antidote for a healthier life is exercise. And when you do exercise, every Muslim says the person 3-4 rounds. So on chubby or concussion and miss the way for win boss over home boss. It all leads us to all these conditions. My good brothers and sisters watching us this morning, say, would to me and go into very, very good health situation, you will really enjoy life. And Bafo can tell you what they are going through. You go to hospital, you see patients crying. And we sit here and do politics with it. Now we talk about national health insurance. So national health insurance, we are going to put dialysis patients on national health insurance. It's a super idea. But how sustainable it is what we are talking about now. You can clearly tell me, say, oh, there's no doubt about that. My brother is at Ghana West Municipal Hospital facility. Yes, there. Clearly, we all know. I mean, don't, even though he's a politician, but I think it's a medical soup, so I don't know. I stand to be corrected. But he knows better. But
is enough.
Yes, no, but you see, what I'm saying is that if you even look at that situation in the patients that are dying in the facility, based on this, but the sustainability, and then with the national health insurance, the core hospital, it is not functioning. That is the reality. So, are you saying that?
And are you saying that the people with NHIS,
the pay now is cash and carry?
You sure?
No, it's obvious. No, I mean, they can just give. I can take 3 minutes of my time for them to phone in and tell you.
I'll find out from the private health.
No. Service provider will tell you. I have worked directly with a claim before. From Ruku Ford's time and later part of President Mills' time, I've worked in a facility. It is not working. This government, as said, they were going to put in a measure for these young children who have is it cancer or there are some conditions. It's a young childhood cancer and those things, and then special children and many can say they are all struggling to pay claims at the to pay at the facility. So Ben himself, he will do all these things. Dialysis, they don't start to collect. We needed only 3 million Ghana cedi for dialysis patients to be able to bring drugs on board. Minu can say, when him say, I say, Minu I can't say, at Tema port now, antiretrovirus drugs have been stuck at the port. When him say, about 100 containers. Omuyibi promised here last 2 months they were going to bring it. HIV patients are dying not out of their fault, but the negligence of.
Malaria.
No, it was antiretrovirus, malaria, and some other drugs. It was
banned there.
No, it was there. Antiretrovirus, it was there. It clearly was there. Even let us even dispute about the Minister of Health disbanded that. Go and read the Minister of Water and Sanitation report. They are saying that 510 children die annually. Not less than 510 children die annually out of HIV, out of malaria. Are you aware? So do you sit down for future children about 500 die every month, every year because just to use money to go and clear? Meanwhile, we have a situation that the state has set up an institution called Ghana Supply Company. Their duty is to clear goods and services for the state. What are they doing? You've even shifted to the private sector. So I think you're critical into that. But that's what the NDC government and President John Dramani Mahama is actually focusing on health preventive. So when you say, share a manifesto, we have something called e-medicine. I don't know. Yes, the 2020 manifesto. Okay. We started with the e-medicine where we are going to make sure that diagnosis will not even actually. And then, me sorry, fee say, Mefi Bunkrugu, answer my bank, answer my diagnosis. So we have plans that we are putting into making sure that we rebound the health sector. And that's what President Mahama Eka clearly said. Under his government, I think the good thing is that under the government, President Mahama himself is not going to focus on health. When him say, the running mate Professor J. Not focus on who is a mother. Who not once about the idea, where you have the feeling for the children. Until Professor J. Not focus on is not going to focus on health, and we are going to critically look at health preventive. It's one of our major priorities.
Preventive health.
Preventive health. It is one thing that we have to do. And I think, Tamayewo School, we have this called physical education. We should rebound the physical education, inculcate. And we should educate them. Then they'll have that feeling. People think they're only sportsmen that can do exercise. So basically, we start class 1. You have that mental setup. Say, I don't know what in Europe, European countries are. If you move every kilometer, they put exercise machinery there, like a gym, a free gym.
Really?
Yes.
Every kilometer.
Every kilometer, they put a free gym, and then you can have access to exercise. So early morning, you see people actually, it's one of the things, and we must make it mandatory for them. If you invest in that, it will come down. But then, the National Health Insurance thing, and then President John Mahama, we critically look at this things. We know President Kufuor started with mutual health insurance. And mutual health insurance, the drug was only 25. That was antibiotics. But then President Mills we move it to national health insurance. The mutual health insurance, say, until me quanta staff, I need to pay for the service.
Yeah.
So, and it's only some, basically, the major surgeries were not part of it.
But at least it was a start.
But it was a start. Even President Rollins started with agent. You remember, when you're 60 and above, you have free, you have an insurance policy that covers you.
Oh, okay.
Yes, and the President Kufuor started with the mutual health insurance. That way, it's within your municipality or district assembly that you have access to medical health care. President Mills moved it for mutual health insurance. With a mutual health insurance, say, national health insurance card, African Tampu North. No, Gan West and Gan East, you can access medical health care. Now, move the drug list to almost 90. Now, President John Mahama, with his own wisdom, what he did was that, yes, it is true to say we have antibiotic and other minor medical cases that national health insurance, but the major thing that we realized was that it was basically surgeries, like cases like CS, surgery and all the other major cases. That's why if you do surgery, it will pay. But President Kufuor seek the EU funding for the mutuality, but it was a 10-year plan. Every 10-year plan, President John Mahama made sure that he put CS into it because those Manoko who are, they said they lose their lives, they lost their life and other things. And what he added major surgical cases into it. And doctor will attest with me now, under President John Mahama, if you go and do typhoid perforation, it's a free medical condition. You go free, you don't pay.
What is it called?
Typhoid perforation.
Perforation.
He knows what I mean. Okay. So if you go for a case like atopic, it's a surgical emergency. And the idea is that say me here scans and Masako hospital we are able to do what? Say a bit strangulated hernia and other cases. The President John Mahama has put major surgical cases to it. Then President Kufuor also he has also started with the renal system, so but it's time overdue. People are really struggling. But we in NDC have you at heart and we'll critically look at it. Any policy and program you have, you can bring it to us. We'll put it in there, and then in the next 7 months, we'll take a critical look at it.
Mami with Frank Toblu, na member studio. Over Frank Toblu, so na yet moye cash and carry is here.
That is exactly I want to say, sir. Our statement no and I can say the health insurance card is not working. It's not true. It's not true because so Uba Yen Hospital, Sisi Amika say, we are using the National Health Insurance list to provide service. But issue is the National Health Insurance tariff list, and a medicine list, is always not economically reasonable. It's not updated to the extent to say a top paracetamol from the wholesaler, 2 cedis. On the National Health Insurance list, a 1 cedi 50 pesos. And a sad difference of 50 pesos, most often than not, and nuna you can say a top up and a co-payment. And it's all can say the health insurance card is not working in the hospitals is not correct. Besides, and yes, sir, it is for all drugs. Those that are on the health insurance list and the values are not reasonable enough for us to keep our business up. That is when we go for top up. Okay. And idea, any national health insurance, yegusu ekenwasem. To the extent say we appealing to them and I catch almost say they should bring values reflecting current economic situations.
Okay.
Okay.
In to top up now, can mojo patients no. Top up no mojo patients no.
What's Frank saying? Because
top up no mojo patients no.
Exactly, ye free omo.
And to mama patients near where say we a top up and yet the entire cost.
to the extent say if we even give receipt to them to prove say any idea illegally. Okay. Because say you can't top up. Mami use a quite way extra adeba kumu regarding
do it for me in the next 30 seconds. Why?
Mate. Assembly said it is obviously and technically illegal to collect money from a patient who visits your hospital. But it is also economically unwise, say, unji sasikano to sustain your business. Because the drone man nipano and health insurance is paying you less than how much you are buying from the market. Ubaye then a sustainable business. And the way it is not about issues of legality, where you're correct, where you're correct, where you're legal, where you're illegal. All right. So one to me, aye, and a nipana ba, one to me, anya draw man for the next coming, nipano obey. Okay,
Mate, Medase, thank you very much for joining us. Frank Toblu, with the Private Health Facilities Association of Ghana. Well, no. Hold on.
No, he said it's not true.
Yes, exactly.
No, but so let me clear it. Let me clear it.
You said it wasn't what they are doing cash and carry. I said they are not doing cash and carry. I'm
your resource person. What?
So he operates a facility.
Operate a private facility.
Yes.
Okay, and also it is not true. But what you top up? Now me facility. Now me after consultation ni be out try my pharmacy. No trouble this man account go to. What do I know about it?
And so me
just me tracker.
Yo, Mate.
So is the
I think
yes,
Mr. Tubu has dealt with the point. That was my first thing to say.
The point that we are paying.
He has dealt with the point.
That we are paying.
And my brother started well.
Yes.
I say he didn't want to do politics.
Yes.
But he ended up doing more politics than
No, I didn't do politics. I'm telling the
It is never true.
Okay.
It is never true. It is never true. I see you present the NHIS card to a hospital and it's rejected. This is a private man talking.
I didn't say rejected.
They don't accept it.
Yeah.
No,
you made that emphatically.
You pay cash.
You made that emphatically. You made that with NHIS. There's no hospital. This hospital with your consultation. Okay. Because now, even with the
service charge,
even with the electronic system now, the moment you present your card. Now, your borrow NHIS card, it was near creative folder now automatically your cost is zero on the system, on the computer. When you don't have insurance and you create one because there's no column for insurance number to be inputted, then the system will generate a folder cost for you. Certainly. It is not true. Let's see all the card but the current situation, NHIS on the drug list, condition list, and now one package. For example, CS, Oba, remember 1,005, remember 1,000 what? Say, Oko ahead, now render certain services, and now in draw no your classes. Oko fa a draw, if UK, my patient, for example. Now, ocean the condition, now we hear say draw now because it's UK brand or American brand, A new lesson, so until they will take what NHIS give them and the top up being done. But the regular drugs, though effective, I know it's on the insurance. That's what the man.
But the challenger we want to say, how do you tell me? Say we now trying to talk.
If you come, now you are doing cesarean session. Now your man withdraw. Now the draw no cost in here. For example, 10 cedis. Now NHIS caters for let's say 7 cedis. You ever catch also your draw near 10 cedis. NHIS component 7 cedis. Then you pay 3 cedis.
Okay.
That's how it works.
But you give me a bill to pay.
Yes.
But you give me a bill to pay after service.
Your point is that the card is not accepted, and that is not true.
You charge them.
Now, let me tell you why. Let me tell you why your point is even further faulty. I made this point,
yes,
and I'll come back to it. You came to meet a scheme which had total population of active subscribers 12.5 million. It's a report you people generated. Honorable Benkumbo as sector minister in 2009. Honorable Sylvester Stete as NHIS. No. Whatever, whether district level or not, in the end, 8 years from 12.5 million, Mufi Hono, not active subscribers, 11.03 million.
That's not true.
So it's the truth.
It
is your report.
That's not true.
I have it here. It is your report. It is your report. This is it. Please. It's here. It's your report. I have it. This 2016 National Health Insurance Scheme report. This is it. That's how it's online. I'll show it to you first. I'll show it. I didn't write it.
Yes.
This is your report. So this 2016. The executives are here. I didn't chantro. I put it online. Mean chantro. This is the number of artist subscribers. In 2012, it's drew 8.89 million subscribers.
Check the conditional problem. Just
please,
check it in there.
At the end of the 2016, 11.03 million subscribers. And this is Honorable Benkumbo's report. Time on power no. NHIS annual report. Honorable Benkumbo, Minister for Information, Honorable Spectator, CEO. This is what you came to meet. This is what you came to meet. So don't come and sit here and do the politics.
No, but see.
Don't come and do the politics.
I'm explaining better for you.
No, how do you explain it? There's no explanation. There's no explanation anywhere. There's no. It is what it is. There's no explanation anywhere.
That was where we're doing insurance migration.
Oh, please. There is no explanation anywhere.
Insurance migration.
You came to meet. This is the truth. You came to meet a scheme that had a population of 12.5 million subscribers, and you ran it down to 11.03.
You are talking about subscribers.
It means you couldn't even maintain the numbers who were on the scheme. You brought it down.
How does that help going?
How it helps is that if the scheme, the confidence of the populace in the scheme is dwindled, how would you go and say, I want to
people pay levies?
Oh,
no, pay levies.
How would you say I'll subscribe on it? Today, I've lifted it from the 11.03 million people I came to meet on the scheme to 17. Extra 6 million. They didn't have confidence in the scheme. So don't come and compare values when it comes to NHIS and
these numbers are bringing. This
is the truth.
We all have a opportunity of working facilities for. So
in finishing, you let me make my point. The emphatic truth is that you came to meet a scheme in 2008 at the end of the year. 12.5 million subscribers. You brought it down. You couldn't even maintain the figures. Today, I'm doing 17.2 million subscribers. Secondly, what's it? Prof. Nana say, taking care of health. Prof. Nana so be taking care of health.
It's taking responsibility.
Now your bar or Joe that same woman as Oba Sector Minister for Education, no continue UPSC, no pass a bill to allow university students pay utilities. So what do you mean by your bar or dream and obey say that same woman, your bar, you should be able to think of children. You sat in UPSA and you pass the bill that makes students pay utility bills in the universities. So don't even come there when it comes to NHIS, you boycotted it. And the excuse about Bagbin, honorable, you led minority gave was that you did not believe the way. Now, in finishing my point, interjection back and forth.
I don't even need an hour to explain this. You see, when we came to meet the mutual health insurance, there was huge backlog and debt. So there was insurance in confidence in it. When migration from the mutual to national health insurance, people actually didn't have this confidence. Until we started releasing funds.
8 years.
If you check to 2009, 2010, 2011, you see the funds we released.
In 8 years,
the service providers.
In 8 years,
so you saw huge release of funds to it. Then people now begin to have appetite in it. And then you know that if you talk about the less number, every Ghanaian pay NHIS levy, you know that. But we were able to get enough revenue to pay the levy. But when you came, you were able to hold on to 90% of the funds.
At the point of the day, the confidence in the people, the confidence in the people,
and
NHIS under you was nothing to rattle about.
And that is what was. So
it was nothing. You had the opportunity to stay in power for 8 years. I feel now I'm promising for dialysis. You had the vice president and president for 8 years.
Nnawotwe Yi, Nnawotwe Yi, so Samuel Brace. On behalf of the team, please, thank you.